myself and two other colleagues, Kirsten Palambaro and Robin Dole, were charged with looking into establishing a potential pro bono clinic here in Balin Hall. We began to check into that possibility, and we found out from surveying community members, community physical therapy clinics, that yes, indeed, there's a need for pro bono services. Many times clients max out their insurance. They don't have insurance, and for multiple reasons end up not being able to reach their maximum capacity. So the idea was that we could have a clinic here where students under the licensed supervision of physical therapists could indeed treat those clients. We crafted an organizational model that put students at the heart of the leadership. Several of us on faculty provide some supervision as they organize and run the operations of the clinic. And then we bring in supervising volunteers to oversee the actual clinical operation of treating patients.
The mission behind the clinic is first and foremost to serve the community of Chester and the surrounding area, specifically the physical therapy needs of individuals who are either uninsured or underinsured. At the same time, providing a very unique and valuable experience to students who are becoming physical therapists as they engage in both the practical component of learning the skills of physical therapy and also the administrative and leadership components in running their own clinic.
In your first year and a half in physical therapy school, you're not necessarily getting a lot of hands-on practice. So you're sitting in really didactic, lecture-based classes that are really important to becoming a physical therapist, like anatomy and histology, but that don't really connect you with the reasons why you wanted to be a PT in the first place. And so the clinic really provides you with an opportunity to practice the skills that ordinarily you wouldn't get to do until you were, a year and a half in, until your first clinical experience. And also just because we're part of the Chester community, and Widener is not just Widener, and so you can come here and meet our neighbors and interact with our neighbors in a more engaging format, and you can help to serve the Chester community.
People are nice. It's a pleasant atmosphere to come, and you are one-on-one. Somebody is always with you and always watching what you are doing and if you're doing it right or if you're doing it wrong.
The clients have been great. I was actually really shy when I first came in because I didn't know how I was going to be taken, but they've worked with us and they know that we're students and they're just great. They're just so grateful for our services that working with them is such a pleasure.
It was very helpful, very interested. They help you in with any way they can. They're very friendly and they don't let you down. They give you a lot of courage.
Every patient interaction is another opportunity for us to work on our communication skills, for us to work on our problem-solving skills. Every patient comes with just a different set of impairments and different personalities, and so not every technique works with every single patient to get them motivated, to get them willing to buy into what you're trying to help them with. So definitely it helped me with my interpersonal skills and being able to effectively communicate with patients.
I've actually think I've gotten more than I, have deserved or whatnot from the students here. They've been great. They're really helpful and they've taught me a lot about my, injuries and what I can do at home to help myself and how to progress from there.
I actually think that we are really thorough because we are students and we're trained to look for a lot of different things, and so I think that we provide a little bit different, a different way of doing things than other clinics because we are so thorough in what we do.
I actually think it's better than a lot of the facilities I've been in. One, it's newer, which doesn't hurt. And two, it's kind of more of a homey environment feeling than some of the other clinics I've been to that feel like a medical clinic, feel like a doctor's office, where this has comfy couches and comfy chairs and all the equipment's new and nice. We really have tried to make it so that it feels homey. Since we are providing pro bono services, we didn't want them to feel like they were getting subpar care.
We're very explicit in that we are student run, but also led by licensed physical therapists that supervise us throughout all the treatments, and explaining to them the benefit of that model. That's how we achieve the low cost of care, but also providing the high quality of care. that anyone would want out of a healthcare facility.
Becoming part of the clinic is really twofold. One is it gets you into, if you don't have prior experience in a clinic, it really gets you in there and it gets you involved very quickly with treating the patients as well as the documentation, as well as all of the ins and outs of running a clinic, all the administrative duties. So you really get to see how to run a clinic from all angles, whether you're the therapist, treating the client, or helping out with administrative duties. You get involved in all aspects of that part of the clinic.
I find with the students that I've been working with over the past year, they're the ones that have excelled when it comes to their clinical rotations, because they're getting in here and they're getting a chance to get the practice working with real patients and basically get all the bugs and the kinks out of the system. When you're more comfortable working with patients, it shows with your real patients once you get out in your clinical affiliations. And the chance to come in here and start honing those skills from day one is going to be really invaluable as time goes on.
Opportunities that we're given here to work alongside physical therapists and be hands-on with our patients is critical for us learning in the PT field. And it's a great opportunity for us to work with a lot of patients and provide a service for them that they otherwise wouldn't have.
It's really easy, honestly. I mean, class is right down the road, like a couple blocks maybe. Usually class is ending almost when this is starting, so it's a real easy transition.
For me, I have loved seeing how engaged our students are and just watching them become physical therapists before our eyes.
For other students that aren't doing it, they should be doing it because it's a fantastic experience.
It's really good to get to know all the people in the community.
I think they're the best ones around. So please, if you have a problem, get a hold of them and they will help you 100%.
We would like the people in this community to, when they think about physical therapy, to think about Widener.